Good morning, everybody. I'm Vicki Bukta, the Vice President of Care Improvement at the Arizona Hospital and Healthcare Association, better known as AHSA. I want to welcome you here today to this inaugural Health Equity Organizational Assessment, or HEOA as we fondly know it, collaborative conference. The AHSA Care Improvement team has a history of leading quality and patient safety collaboratives with demonstrated outcomes, including saving lives, reducing harms, and saving money. Although health equity is integrated into all we do, this is actually the first collaborative that in Arizona focused on improving equity in organizations that care for rural and underserved communities. But let me just pause for a moment, and while I'm talking about care improvement at AHSA, I'd like to introduce our team, and if you all would stand up, I'd appreciate it. Megan Trosco is our director for care improvement, and I know you know these folks from our calls, but yeah. The first thing you're gonna say is, you're taller than I thought you were. Rafael Cota is our quality and patient safety program manager. Jacqueline Sain is our project coordinator, and Whitney Jackson, who's in the back of the room back there, is our loyal administrative assistant and office coordinator, and just the hostess with the mostest for our sessions. AHSA also assembles hospital and healthcare leaders nationally and throughout the state for a variety of conferences, including this one. This interactive conference will give our HOA collaborative participants the opportunity to share accomplishments, stories, and lessons learned as we continue our journey of health equity. I want to thank the Arizona Department of Health Services for their support through the CDC COVID-19 Health Disparities Grant funding and other contributions, such as statistics from the ADHS data team. And if I start calling out people individually, I'll certainly forget, but I know Holly Starr is here from the ADHS data team, so I want to certainly say hello to her. There she is at the back by the breakfast. So thank you. Thank you. Siobhan is here. Thank you very much for your support. We really, obviously, we could not have done this without you. I also want to thank Stratizan, who worked with us on bringing together all of you, not only for today's day of learning and collaboration, but for the entire collaborative process. As we were taking on this work and we knew we needed help, we put out an RFP, and we were delighted when Stratizan applied, and even further overjoyed when we were able to contract with them to help us with this work. As you know, those of you who have been with us from the beginning, they've worked lockstep with us all along the way, and this is really their area of expertise, especially when it comes to the part of all the facilitation and then the data that have just been so incredibly strong. Today's agenda is filled with outstanding speakers who will bring the latest information on recent trends, best practices, policy development, and advocacy efforts. You're going to hear from prominent local organizations such as Circle the City, the Arizona Commission for the Deaf and Hard of Hearing, and the Arizona Advisory Council on Indian Healthcare. We're also very proud to welcome our keynote speaker, Benjamin Anderson, Vice President of, I snoozed it. Benjamin Anderson, who is the Vice President of Rural Health and Hospitals for the Colorado Hospital Association. So we're really thrilled to have him join us a little bit later today from a fellow hospital association. And of course, I want to acknowledge the hospitals and clinics who participate in the collaborative. We have folks here from Benson Hospital, Canyon Vista Medical Center, Carondelet Holy Cross Hospital, Cobra Valley Regional Medical Center, Gila River Healthcare, Havasu Regional Medical Center, La Paz Regional Medical Center and Clinics, Little Colorado Medical Center, Mount Graham Regional Medical Center, Northern Cochise Community Hospital, and Valleywise Health. And just from hearing all those names, you know that a lot of miles were put on between yesterday and today, right? Traveling to get here. So we really want to thank all of you participants for being here. We know it takes time and commitment for you to be here, and we really, really appreciate it. Before I introduce our next presenter, I want to introduce Leanne Lambden, who is the Senior Principal Consultant with StrataZen. Leanne's here, and she's going to be taking the handoff from Whitney, who welcomed you in registration, but she will be our hostess with the mostest here for the remainder of our program. And then next, I want to call forward Christy Abrams from the Commission for the Deaf and Hard of Hearing. She will explain what an accessible conference looks like and what we as a group can expect from the interpreters and from the subtitles. Christy, welcome, and thank you for being here with us today.
Good morning, everyone. This really is a wonderful opportunity to be here with you all today. I am the Hard of Hearing Specialist with the Arizona Commission for the Deaf and the Hard of Hearing, and I do have severe bilateral hearing loss myself. I've been wearing hearing aids since I was 5 years old, and I just want to take a moment to highlight something that's really crucial for me and so many other people that live here in Arizona. We have more than 1.1 million people in Arizona who have some level of hearing loss. And if you, looking across the room, 1 out of 5 of us have some level of hearing loss, whether it be mild, moderate, severe. So it's really important to understand that and what that means for having access to information, especially when we walk into a healthcare appointment and everyone is wearing masks. So I just want to highlight today, being hard of hearing, for me, what makes it inclusive and what gives me access to information is having the captioning you can see on top. This is called Text on Top, and we have a highly trained nationally certified CART captioner, Tracy, right over here. And she is captioning, it's called Communication Access Real-Time Translation. So this is the gold standard, and I always say it's the best kept secret. CART can be provided in meetings like this and medical appointments. Hard of hearing patients can request it. They can have an iPad with them, and it can be provided remotely or in person. So just as my colleague Kim here is deaf and has an ASL interpreter, she's going to be telling you a lot more about that. But CART is what gives a hard of hearing person access. So I really wanted to just highlight that for all of you, and I hope if you have any questions later in the day, you'll find me and ask questions. Thank you.
Thank you very much. We also have an interpreter up here. We are so proud to make this an accessible meeting for the deaf and hard of hearing, and we hope that you take away from this experience things you can do in your facility, so it's like dual purpose. As mentioned, I'm Leanne Lambden with StrataZen from Nashville. I flew in yesterday, and boy, are my arms tired. It's really nice to meet you in person. We've been on quite the journey together. Our first learning call was July 14th, if you'll think back. We spent the first 3 months of the collaborative learning about health equity, definitions, examples, different types of health equity. In November and December, we began creating our gap analysis between how we wanted our organizations to be and where we were based on our first health equity assessment that we all took, if you remember. And in January, we began selecting our projects, your projects that you wanted to implement in your hospitals. We did that until April, when the posters were put together that summarized the projects that you all designed and implemented in your organizations. This meeting is the culmination of all of the learning and work that you all have done over the last 9 months. So I'm going to talk about our agenda and our purpose for the meeting. This is a forum to celebrate the efforts and successes of the collaborative participants, share processes, stories, accomplishments, receive insight and inspiration to continue the journey of health equity. And by the end of this meeting, we want collaborators to feel proud, informed, and have a sense of community. So if you all will remember, as part of our monthly one-on-one learning calls that we had with every organization here, we asked you all for at least 2 meetings, maybe 3. What did you want to see in this meeting? What did you not want to see in this meeting? And we designed the agenda around what you said you wanted and what you said you didn't want. I'd say we came 90%. I won't say 100, but we came fairly close. So thank you for designing our agenda. So that is what we'd like to accomplish. We're in the welcome and introductions phase of the agenda. We're going to do a getting connected activity. We're going to move on to, we're going to have 2 panel discussions today. The first panel is Amplifying Local Voices, and it will contain the 3 organizations that Vicki mentioned, Arizona Deaf and Hard of Hearing, Circle the City, and the Indian, I'm going to get the name, wait a minute. Arizona Advisory Council on Indian Healthcare. So that'll be that panel. After every panel, we will have what is called an open forum. And that is the chance for you at your table to discuss, and you'll notice there are these posters around the room. After each panel, you're going to discuss what did we hear, what are our reactions, and what are our questions of understanding, and for whom. So you'll say, Kimberly, our table wants to know, blah, 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 blah. And it'll be a facilitated Q&A period, so you'll have 10 minutes to have this discussion at your table, and then we'll have a 20-minute Q&A period where I call on each table. One thing to remember about today, since it is an accessible meeting, we have to have microphones for everyone who is speaking. So there will be microphones that come to you during the open forum. They will ask you who your spokesperson is, and you will have a microphone to ask your question. And the panelists, of course, will have microphones for their answer. So that's the first panel. Let me talk about the most important part of the day. Then we have lunch. After that first panel, we'll have lunch. We'll also do a gallery walk. You'll notice your beautiful posters over here. And I'll talk more about that, how we're going to do that right before lunch. Our second panel is going to be 6 of the collaborators who volunteered to speak during the collaborative panel discussion, and they're going to talk about their experiences through the collaborative. You will have an open forum. By the time we do this 3 times, you're going to know exactly what to do. You're going to talk at your tables. What did we hear? What are our reactions? And what are our questions of understanding and for whom? So you'll have plenty of time to get the questions answered that you want. Then we're going to take a break. You'll have 15 minutes for a break. Then we're going to have our keynote address. You'll also have an open forum. So that after Benjamin Anderson finishes speaking, you'll do what did we hear, what are our reactions, and what are our questions of understanding. You don't have to have the for whom part because he's really the only one going to be standing up here. Then we're going to do next steps, evaluations, and adjourn. So that's our agenda. I'm going to talk about some logistics. So you may wonder why you have an assigned table. We wanted you all to easily network with and learn from each other. That was something you said you all wanted to do. So we mixed the tables up and included at least 1, and most of the time 2, non-hospital participants at each table. We have the health department. We have our 3 panelist organizations, Arizona Office of Rural Health. There's some other people here because we wanted to provide a maximum mixture of participants for learning. So that's why we did the table assignments. Some logistics, the restrooms. They are out this door to the right. I think women's is on the left, men's are on the right, and there is a non-gender-based bathroom also back there. Please silence your cell phones. You don't want to be that person. If you do have to take a call, we understand that you're very busy and you still have hospitals to run, but you can put it on vibrate and you can take your calls out in this lovely area out here. You have handouts that are in your blue folders. I will be referring to those. So for example, if you didn't have your agenda out, your agenda is on the left-hand side of that folder. You'll notice other handouts on the right-hand side. We will be referring to those, and they're color-coded so I can tell you what color you can pull out. You also have an online brochure. There is a QR code at the bottom of the agenda, and that'll take you to the OzHaw website. Pretty much has the information that you need here except for the speaker bios. I will introduce the speakers and give you a little bit about them, but there's more information on the OzHaw website. All right, a couple of norms. Stay in the room as much as possible. If you need to take a call, great, but come back because your table really needs you to have the full perspective. Do whatever you need to do to stay focused. If you need to use the restroom, use the restroom. You don't have to wait for a break. If you're falling asleep, stand up, stretch, walk around the back of the room, but come to your table when we have the open forums so that you can participate with your team. Listen to each other in a way that will enable you to see the world through each other's eyes. Everybody has differences of opinion, and that's good. Remember, each person's truth is their truth, so make sure we don't disrespect anybody's opinion. We're on a tight time frame today, really tight. That's why my alarms keep going off, because I have so many alarms set. So please stick to the schedule. When we tell you you have 10 minutes, you have 10 minutes. When come back from lunch on time, come back from break on time. We will let you know how long each item on the agenda will take, but if you really need a specifics on the agenda, like I need to know exactly what we're doing at 2:15, just see one of us and we'll let you know. I'm going to ask you to take out your green handout. This is green, right? This is green. All right, pull out your green handout, if you will. And for your Getting Connected exercise and for each of the open forums, you're going to need a facilitator and a spokesperson. For the open forums, you'll need facilitator and spokesperson. For the Getting Connected exercise, you'll also need a recorder. But that's the only one you'll need 3. Please rotate these around the table. Do not make Nelson be the reporter for every open forum. Rotate those around the table. These are the responsibilities. You all know, you've been to plenty of meetings, but the facilitator, the most important job for the facilitator is to listen to how much time you have for the exercise and make sure the group stays on track and gets through the exercise. And the most important role for the spokesperson is to listen and know what you're supposed to report, and then use the microphone to ask the questions or report out. So those are your roles. What questions does anyone have about what we're doing today? Great. We did a great job of explaining what we're doing. All right, so now we're going to do the Getting Connected exercise. Please pull out your yellow handout. And the first thing you will do is choose a recorder, a facilitator, and a spokesperson. You have markers at your table. You also have a flip chart at your table. You'll take 2 minutes to think about, not your name and organization, hopefully that comes to you pretty quickly, but what you see that makes you feel positive about the Health Equity Collaborative and the work that you've done, what you see happening that makes you nervous as you and your organization move forward with health equity, and 4, what you need to get out of today to make you feel good about being here. Then, after you've had your 2 minutes to think about that, you're going to go around the table. Each person has 2 minutes to answer those questions out loud. The recorder as a table, you'll agree on common themes, any significant differences and outcomes the group wants. The recorder will put those on a flip chart or several pages of a flip chart. Yeah, they're on the ground. Everybody's like, where? They're on the ground. You'll have to pick them up and put them. And when you report out, and I'll emphasize this again, the report out will be the desired outcomes that the table needs. Although you're going to talk about common themes, significant differences, outcomes the table wants. Okay, you are going to have 26 minutes. I know, not 24, not 27. You're going to have 26 minutes to 2 minutes to think, and then go around the table for 2 minutes, and then you'll have about 10 minutes to agree on common themes, significant differences, outcomes the group wants. Any questions before we start the Getting Connected exercise? How many minutes do we have? 26. Thank you. All right, go. So what we would like the spokesperson to report are the outcomes that the group needs. Megan Trosco from OSHA is going to write on the flip chart up here the outcomes that you all need from today, and then we'll address those prior to moving to our first panel. All right, so what we're going to do now is I'm going to call out 2 tables by number. The first table will be the one that's going to talk. The second number, be ready. Okay? So we're going to start with table number 1, table number 7. You'll be up next. Oh, sorry, I lied. It's 1. Just go with the flow.
All right, thank you, everybody. Great conversation at our table. I would say the outcome that we are discussed was the commitment of our organizations and just from our partners in the community to continue the efforts that we've started. Again, we talked also about just resources that are available, and again, the sustainability and looking at how we all partner together to continue our social determinants of health with our health equity.
Great, thank you. Table 7, you're up next. Table 3, you're on deck.
Okay, for table 7, our outcome that we really want from this meeting today is really the ability to bring the ideas from the collective group back to our facility and implement them in a way that's very meaningful.
Thank you. Table number 3, and then table number 6, you're up next, or after table 3.
All right, so some of our outcomes were that we want to really obviously come together and share collaborative ideas and have that sense of community. And then we also talked about resources and sustainability and how this is going to impact us as healthcare organizations.
Great. Table 6?
Hello.
And then table 2.
So the outcomes that we really talked about were resources and being able to bring ideas to fruition.
All right, table 2, and then table 4, you'll be up next.
So our outcomes, we discussed 3 different things: general learning, continuation of learning, the different perspectives. We have a large community versus a small community, being able to get those perspectives, and as well as networking.
Great. Table 8. No,
4.
4, and then 8.
So we share a lot of the themes that have been shared already, but mainly increase of awareness and what everybody else is doing, and to bring those resources back to our hospitals and to our community.
All right, table 8 will be the last table.
Yes, what we discussed was actual items that we can take back to each facility, and then to piggyback networking, the ability to reach out to the diverse group of people sitting around this table to be able to help solve some of those issues. So.
Great. So let's look at what everybody said. Oh no, I have to move with the microphone. All right, we have the commitment. So hopefully we'll build that at the meeting. Bring ideas from the group back to your facility. That will be done both with the panels and with the walkabout. from the posters. Share collaborative ideas, same. The poster walkabout and the 2 panels. Collect resources, bring ideas, same. Continue learning, hopefully that happens with the panels, the keynote. Networking, that'll happen at the tables because we mixed you up. And hopefully that'll happen at the breaks and lunch and the walkabout, as I call it. All right, and build community to help solve issues. Okay, I think we can meet all of these with the agenda you all created. So thank you for participating in that exercise.